Hello, I'm Dr. Rodolfo Savica. I'm assistant professor of neurology at the Mayo Clinic, and I'm here to present my study that is entitled High School Football and Risk of Neurodegeneration, a community-based study. This study is going to be published in the upcoming number of Mayo Clinic Proceedings, and it will be available also online. In our study, we tried to investigate a pretty controversial topic, which is if high school football is increasing the risk of neurodegenerative disorder later in life. For this reason, we reviewed the yearbooks of the students that were attending high school in Rochester, Minnesota from 1946 to 1956. In this 10 years interval, we identified people that were playing in the high school football teams and in the band or choir or glee club, and we compared the two groups later in life. After 60 years, 50 to 60 years of observation, we find no significant difference between these two groups. In other words, people that were playing earlier in life football in high school were not an increased risk of Alzheimer's disease, Parkinson's disease, of ALS, as compared with the one that were not playing high school, but they were involved in other activities, such as playing music, singing, or be part of the choir. These findings are far to have a direct impact on clinical practice. We should know more about the role of sports-related activity, including possible head trauma or possible concussions, to better understand whether these activities are playing a role in the long-term outcome of patients or persons that are engaged in these sports. On the other hand, it's important to know if the people that are coming to their physician office have been exposed to activities that can increase the risk of having a trauma, because a trauma is still one of the major risk factors for some of the neurodegenerative disorder, including Parkinson's disease or Alzheimer's disease. Regarding patients, these findings are somehow reassuring for the people that were playing footballs in that particular years, from 1946 to 1956. Unfortunately, we cannot generalize these findings or can use these findings in the current era of football players for several reasons. For sure, football players now are stronger, bigger, faster, and the hits are somehow harder. On the other hand, people in that particular era were having helmets that were not really protecting themselves, since they were helmets that were basically leather, the so-called leather dogs helmets. But on the other hand, the current helmet may provide a sense of false protection to the athlete, that since they're bigger, stronger, and faster, they're going hitting stronger the opponents. So for the patients, it's reassuring only for the particular era, but it's something that deserves further studies to understand what are the implications for the current era of football and for the current patients that are playing football. The next step would be definitely to increase the years of observation and eventually increase in this population the numbers of years that we are trying to study. We studied starting from 1946 because before that there was World War II and it was difficult to have any access on yearbooks. For sure we had to include other sports that were not available at the particular age when we did the study, and we had to wait some time to see what is the long-term outcome of the people that were engaged in sport activity. Moreover, we also, as scientific community, we also had to understand the underlying mechanism that is present in people that are having a trauma and subsequent neurodegenerative disorder. It's something that deserves to be studied and to be further explored with multi-center trials or multi-center study that are assessing an entire population of sportsmen. This could be important also for the ones that are going to drive and have a trauma. So in other words, the implication in our normal daily life. The take-home message is that students, high school students, they were engaged in football from 1946 to 1956 are not an increased risk of developing later in life Parkinson's disease, dementia, and ALS as compared with students who were not engaged in that particular sports in the years of interest.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.